Good morning, everyone. Today I'm going to take a class on trigeminal neuralgia. Contents, definition, pathophysiology, etiology, clinical features, differential diagnosis, and a law note on glossopharyngeal neuralgia and the treatment plan. By the definition, the trigeminal neuralgia is a severe paroxysmal episodic of pain that occurs along with the distribution of any three branches of trigeminal nerve. It was founded by John Forthill in 1773. The synonyms such as stick dolorous, trifacial neuralgia, Forthill disease, and suicidal disease. The trigeminal nerve has three divisions such as ophthalmic branch, maxillary branch, and mandibular. Out of this, maxillary and mandibular branches are all almost affected. Classification. According to the ICHD, the subdivide trigeminal neuralgia into classic trigeminal neuralgia and symptomatic trigeminal neuralgia. Classic trigeminal neuralgia is the most common form, which is idiopathic in nature and associated with vascular compression. Symptomatic trigeminal neuralgia is caused by a demonstrable structural lesion that other than the vascular compression. Moving on to the etiology. Infections such as due to the various granulomatous and non-granulomatous infection and non-granulomatous infections involving the fifth cranial nerve. Other etiologies such as dental etiology, multiple sclerosis, dental pathosis, petrous ridge compression, post-traumatic neuralgia, intracranial tumors, and last viral etiology. What are the general characteristics of trigeminal neuralgia? So, incident is for about 4 patients in a lack of uh, all the patients. Age is a middle-aged, most of the time in the fifth and sixth decade of life. Sex predilection, female are most commonly affected. Nerve branches, which is mandibular nerve branch, is the most commonly involved, and right side of the face is the most common area. Clinical features. Trigeminal neuralgia typically manifests as sudden, unilateral, intermittent, paroxysmal, sharp shooting, and lancinating shock-like pain. This is elicited by slight touching, superficial trigger points which is radiate. Pain is usually confined to the part of the division of the trigeminal nerve. Pain is rarely crossed the midline. During an attack, the patient grimaced the pain and clutches his hands over the affected side of the face, stopping all the activities and hold his face with his reddened eyes. Extreme cases, the patient have a motionless face, frozen, mark-like face. It is characteristic of disorders that attack to not occur during the sleep. Many patients will lead to poor oral quality of the because of the excruciating pain. In 1955, Sweets and White, which is formed some criteria regarding the trigeminal neuralgia, such as White and Sweet criteria, that is Sweets criteria, described a set of criteria diagnosing the trigeminal neuralgia. There are the pain is paroxysmal and sudden in nature. Light touch of the face on the trigger zones provoke the pain. The pain is confined to the trigeminal nerve distribution. The pain is limited in manifestation, and the clinical and neurological examination is very normal. More than 50% of the patient is experience early remission or greater than 6 months before the return of active pain. Several patients have reported to have that many last for a long time for the burning ache with the suicidal tendencies and get rid of themselves for the pain. The severe pain has faded away may give rise to the burning ache that lasts for the longer time after the attack. Differential diagnosis. TMJ-related disorders, odontogenic causes, glossopharyngeal neuralgia, migraine, atypical facial pain, multiple sclerosis, and post-herpetic neuralgia. The glossopharyngeal neuralgia is a type of neuralgic pain. It's another type of trigeminal neuralgic pain. The glossopharyngeal neuralgia is a neuropathy similar to trigeminal neuralgia. Harris is introduced the term glossopharyngeal neuralgia. This condition is less seen in comparison with the trigeminal nerve. What are the triggering factors? Smiling, chewing, swallowing, whistling movements, speech, yawning, and coughing. What are the treatment modality for the trigeminal neuralgia? Which is most primary and secondary treatment can be treated by medication, alcohol injection, and surgery. First one is medication. Carbamazepine, initial dose of 200 mg per day. It can be further increased to 800 to 1200 mg per day. Uh, then baclofen 5 mg twice daily, and maximum dosage is 8 mg per day. And phenytoin sodium also can be used for the treatment of the trigeminal neuralgia. Second line of treatment is alcohol injection. Alcohol 2 ml of observed alcohol mixed with alcohol mixed with 0.5 ml of 2% local anesthetic solution, which is injected into the mandibular foramen as a mandibular injection. 2% of the local anesthetic solution, which is included because to get the anesthetic effect. And the third and last foremost treatment option is the surgery. When the patient is not responding to the medication and the alcohol injection, surgery can be carried out for treatment for the neuralgia. So the treatment aids of the trigeminal neuralgia is carbamazepine, phenytoin sodium, clonazepam, valproate, gabapentin, oxycarbamazepines. So various surgical procedure which is performed is microvascular decompression, treatment, radio frequency thermocoagulation of the trigeminal ganglion, and surgical or a laser removal of the pathology. In conclusion, in conclusion of the trigeminal neuralgia, the pain is confined to the trigeminal zone, nearly always unilateral, and if the bilateral is successive rather than the recommitment. The trigeminal neuralgia is extremely painful condition as it is unique to all the humans. It is the most common orofacial pain. So, for the treatment of plant knowledge according to clinical features and diagnosis of the diagnosis is very important. Thank you. Thank you all.